No, no. We are live. Oh. No, it's not. Hi, everyone. Good, good morning. Good morning, everyone. Good evening, good afternoon, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tulo Labinto. I'm CEO and co-founder of Living Spring Family Medical Center here in the beautiful city of Mansfield, Texas, where we believe in helping our patients live long and well because the quality of life is just as important as the quantity of life. We are having another interesting conversation today. I'm excited to have on today our guest. She is a first time guest on here, and I'm honored to have her. She's also a friend. And today we'll be talking about the topic um, supporting kids with autism with tools and techniques. Her name is none other than Dr. Hokehe Eko. Thank you so much for being here, sis. How are you?
I'm good. It's an honor to be here. Thank you for having me.
Oh, my pleasure, my pleasure. Now, for those who are watching, who are like, okay, this doc, I love her smile. Who is she? What she does? Who are you, doc? And what do you do?
Okay, so I'm Hokehe Eko. I'm a board certified pediatrician that specializes in autism and ADHD. I help children. Um, I do the evaluations for autism and ADHD and also provide ongoing integrative care for those children. So that's in a
Awesome,
nutshell who I am.
awesome, awesome. But why do you do what you do? What got you into this niche?
Okay, so should we say the long story or the short story?
Let's do the shortened one.
Shortened one. Okay, shortened one is that both ADHD and autism are brain-based disorders, and I have a brain story. My brain story, short version is I was a junior in college. I had two car accidents exactly 6 months apart, and
Wow.
then I was told that I was less than average. I would not go into medical school, which I've always wanted to be a pediatrician since I was 5. So the neuropsychologist told me, well, you have all these brain injuries. You're never going to medical school. I suggest you go find something else. So I believed him. I failed out of college that semester, but my parents were like, nope, it doesn't matter what he said. You are a doctor and you are going back to school. So, of course, I went back, but that stayed with me because my parents spoke life to me. That's one big thing I always tell my parents. And they kept insisting that I could do what it was I had set my mind to do. But also along the way, I mean, um, as I became a pediatrician and I started working with kids. I've been a pediatrician for the last 10 years. And over the last few years, I realized that there's so much more to it. Started first with ADHD, right? I realized there's more to ADHD than just us evaluating kids and giving them stimulant medications.
Mm.
I found out accidentally. It was a 4-year-old who was in foster care and he came to my office and they were like, he has ADHD. Yes, he was bouncing off the walls, but also he kept stopping and giving me hugs. So I got like 15 hugs out of this little kid. And I said to the person who brought him, no, I'm not gonna give him ADHD meds. First of all, he's too young, but I think he needs a loving home. And the guy looked at me like I was crazy. I too was like, where did that come from? Well, I found out after 6 weeks that I was right because he showed back up with a dad who was really loving, a foster dad, and I got one hug and the kid no longer was hyperactive. So I was like, oh, where did the hyperactivity go? Right? The kid is no longer bouncing. He's sitting on the guy's lap and like a regular 4-year-old. And so that clued me into wait, there's more to this than meets the eye. So trauma can actually make changes to a kid's brain and the kid can act hyperactive. So if you don't ask these questions, then we're just going to be treating kids
Mm.
without really finding out what's going on. So that led me to start searching out what else can I be looking out for? What else can I be asking? Right. And so that's what led me to doing. I went back and did training in integrative pediatrics, which simply means we're taking conventional medicine, but we're also looking at evidence based complementary medicine and putting them together, essentially seeing the child as a whole child, not just this is this child's symptom. And that's all we're going to focus on. What else is going on in this child's life, including trauma that could be contributing to their behavior, right? And so
Mm.
it's with that lens I I so fast forward, I left my job because I was being harassed, and then I was like, what can I do, right? I didn't want to just start a regular PEDS practice, so I decided, I will start helping out with evaluations because there's a 2-year wait list for autism evals in our state. So that's how I landed on taking care of children with autism, like
Mm.
ongoing, and also ADHD. So I hope that was
Wow.
short enough.
Wow. That powerful stories. Sorry, my background. Give me 1 second.
It's okay.
All right. Sorry about that. You share two powerful stories, your personal experience and that of this young child. And I'm so encouraged and wowed by what you do and that you took the time to go do the things so that you're doing what you're doing right now. I don't know if that makes sense, but thank you essentially for what you do is what I'm trying to say. For those of you who are watching and who know, you know that this is a conversation that a friend of yours should be watching, a mother friend of yours should be watching, or a caregiver's friend of yours should be watching. Please forward this to them, tag them so they can join live. So we're talking autism today, Doc. What are some of the common challenges you've seen that children with autism face? I'm asking this question so we can then segue into how caregivers can offer effective support.
Okay. So there's several challenges that I've found that's across the board that most children with autism face in terms of their health. Most of them I found have constipation or GI issues going on. Constipation, diarrhea, it could be a mix of both. They often have difficulty sleeping. It's hard for them to go to sleep or they keep waking up at night, either of those two combinations. They often are picky eaters, so there's only a small amount of foods that they will eat, which of course um, doesn't lend itself to helping with the constipation, and the constipation also will affect their sleep. So it's a really big cycle. And of course, the issues with their speech. I mean, autism, it's called the spectrum for a reason. There are kids that can be on the spectrum, but you may not necessarily be able to tell because they only have a few symptoms versus run the gamut to nonverbal, can't
Mm,
walk, can't talk, any of that. So it's a spectrum, right? But essentially, these are the major things I found. Of course, in addition to the social interaction and plus or minus the language, right? So those are the major things. But often I found, I mean, even I was guilty of this when I would see children in the past diagnosed with autism or even undiagnosed, and they have all these other issues. We tend to chalk it up to, oh, it's just part of their autism and never
mm,
really address the underlying problems because, like I've just said, everything is connected. So whatever you eat goes into your tummy, ends up in your brain eventually. So if the child is not eating the right foods and
mm.
they're constipated and they're not sleeping well, it's a cycle that we need to address. And so to segue into what parents and caregivers can do is advocate for your child. If you go to see your child's doctor and you're pointing out these areas and you're not really getting the help, find someone who will address those areas, because your child often cannot tell you what really is bothering them, but often their tummies are hurting. If you notice your child like leaning against the table and rubbing themselves, that could be a sign that they're in pain, right? But they may not be able to tell you. They will just
Mm, mm.
act, you see their behavior, they may be throwing tantrums, but it's all maybe stemming from what's going on inside of them. So it's so important to advocate for those things that you notice about your child and not just, oh yeah, it's just part of it. Don't write it off like that.
Wow, I love that. Advocate for your children, and find a provider that would listen to you and address the concerns you're bringing up. Now, you know, let's talk a little bit about early intervention for children with autism. And the reason I'm bringing that up is some of the things you've mentioned. You notice certain things that seem a little different or seem a little not typical.
Right.
And, can we talk about why it's important to have these discussions early and the fear of having a child, your precious one, labeled
Right.
and how you help parents with It's a loaded question.
Okay.
Managing that,
So,
yes.
okay. Early intervention is critical because 90% of the brain development happens in the first 5 years of life. That's why you may, as a parent, you may hear your doctors or even the schools talking about early intervention and how it's so critical we do what we can to help our kids early. And so, in terms of what are the signs or things that you should be looking at, so if you, as I always tell parents, you know your child the best, right? So if your child doesn't seem to interact like other children would, so say for example, your child is babbling, but or like, and then you're trying to babble back at your child or talk back to your child, but your child won't look at you, won't respond directly to
Mm,
you, be looking off in the other direction and still making the sounds, right? Or they're high pitched sounds, or they're not your usual, they sound more like whining versus babbling, those little things that parents may pick up. Don't dismiss it. It's important to bring that to your doctor's notice. um because again, you know your child best, right? And things like your child doesn't make eye contact with you unless like you're right in their face, and
mm,
or they don't respond when you call their name, or things like that. And um I've run into, and it doesn't mean when we say early intervention that there is no hope for your child if your child is getting help at a later age. It's just best if we start interventions like speech therapy or occupational therapy, because I found a lot of kids have difficulty even tying their shoelaces or even holding a fork. So if you find that your toddler is having difficulty holding a fork or a spoon, those are some clues, right? To go talk to your doctor and like, my child may need occupational therapy to strengthen their hands. And so
mm,
don't dismiss that. And yes, as for the fear, it's a real thing of the labeling, and I see that every day in my office, and it's heartbreaking to watch parents and to comfort them as they process the diagnosis I'm giving their child. But what I always tell parents is, what, because with the medical diagnosis, there are levels we give, right? So the number doesn't define your child.
mm,
Every child has a strength. And I tell parents, I'm challenging you, find the strength that your child has and let's boost it. If you find that your child can hear a song and sing it, or can hear a song and play it, that's a gift. And let's boost that gift, right? And accept, I know it's a process to accepting your child where they are, but it's something we have to do as every
mm,
parent has to do it, because our children are not perfect at all in any way, whether they're on the spectrum or not. So it's important, and there is hope. There is hope. There's things that you can do as a parent in terms of nutrition or your environment,
mm,
working on their sleep, that can help your child's behavior improve, their quality of life improve. So it's not hopeless. And there are children who they've had the diagnosis reversed. So that's what I always encourage parents. It's better for us to go get the evaluation, get the help your child needs early, versus I'm going to pretend that this is not happening, because we're not helping the child. And the fact that there is a diagnosis has no impact on the quality of life that your child will live. And that's the
mm.
message we have to repeat over and over. It's absolutely true, because they're geniuses that also happen to be on the spectrum. So um, it's just finding the strength your child has and boosting that. Yeah.
Thank you very much. Very powerful, powerful, powerful advice. Finding the strength and boosting the strength. Every child has a strength. Now, now one of the biggest fears that parents have is, oh my goodness, with this diagnosis, will my child ever be independent, and will they be able to? And I know that's a loaded question, but can you share your insights into how you can encourage the child over time? Simple, tips. Children with autism, how we can foster that in time.
Right. I'm glad you said in time, because it is a process. There is no cure for autism at this point, but there are I have seen children improve. I'll tell a quick story. 9-year-olds I had with ADHD autism, she was nonverbal, and and was very aggressive, wouldn't even let me examine her. But I talked with the parents. This was early on when I was starting my journey into finding out different ways to help children. And we just made some changes in what she was eating and her sleep. And this child said her first word, like mom. And for the first time, I could examine her. And yes, it took about 6 months, but it takes time. But there is hope for
Wow.
your child's behavior or their overall health to improve. It is possible. And again, going back to the early intervention, that's why, yes, to answer that question, it depends, right? I can't sit here and say, yes, your child will be independent, will live on their own, things will get reversed, but it's better for us to try than not try, right? So, which is why go get the help that is possible. If your child is nonverbal, get request speech therapy for your child. If your child
Mm.
is having difficulty with fine motor skills, or you find that they're clumsy, they fall often, that's not normal. Your child can benefit from physical therapy early, and that will help with your child walking better. Those things that I find that are important, and there are things that are available in every state in the US at least, that early on you can get your child the help that they need. So um and then also your environment, what's going on in your environment. Is there mold in your environment? Because I have seen mold affect behavior of children, and when they're taken out of the environment, their behavior improves. So those are some things I would say. And also, what is your child eating? Because once you improve or you make changes in what your child, so some big ones are like dairy and gluten, right? I have
Mm.
found when I take children off dairy and gluten, which is like can be found in wheat, their their constipation improves, which improves their sleep, which improves their behavior. So it's all a cycle. So it's like, where are you going to address this whole cycle or your whole child, right? It's starting in one place or in several places. It's like getting the help they need and also making changes in what's going on at home. So
I'm amazed at what you do, and I like the comprehensive approach. I'm serious. Like I'm not trying to guess you. Like I'm really amazed at what you do. It's like
thank
this
you.
beautiful child, this beautiful puzzle of a child. We're going to figure it out what works best for this, and it's going to take time. But working with the parent, working with the environment, working with food, working with social factors to help improve their quality of life and empower them to live their best life. So
Right.
this is powerful. So for someone who's watching, I want to encourage you. We did emphasize it takes time, but please be encouraged not to give up. And that's why conversations like these are important. Now, I have a parent who's probably looking at me like, yeah, try. First is the child is a toddler, and then with autism, and you're talking about change the diet. Like, do you have tips? Like, it's hard for them to eat certain foods in the first place. Are there any quick tips on how to encourage the transition to healthier or better foods for the child?
Okay, yes, great question. I sort of touched on it when I was just talking, but for example, a big one is dairy, right? So toddlers, yes, need, because they get most of their calcium from dairy, right?
Mhm.
But dairy also constipates, and in children with autism, they already have various GI issues going on. So I tell parents, okay, let's start simple, right? We're not going to overhaul everything in one day. Okay,
Right.
so milk. Your child loves milk. Your child for example, your child is 2 years old and is still drinking 4 cups of milk. So can we cut back to 2 cups of milk and replace that with water? And also, can we go half and half with oat milk, right? Oat milk is non-dairy. Can we start doing half dairy, half oat, and then slowly increase the amount of oats as the child gets used to it? So that way we're taking out something that, of course, is constipating your child, but then we're
Mm.
also replacing it with water, which the brain needs the most water in the body, right? So we need to feed the brain what it needs, which is why I always talk about the brain. If we fall in love with taking care of the organ, the brain, it will take care of us, right? So if
I like
we're
that.
increasing water intake, and yes, you say my child hates water. Okay, what can you do? You can cut up fruits, put it in your water, stick it in your fridge. In 30 minutes, the water will take on the taste of the fruit. Or they have all these infuser bottles. You can put infuse it into the child's water. It's better than using the packets. I often hear parents say, "Oh, I use the flavor packets," but think about it. That's a chemical. Yeah, that's still chemical. And we are trying as much as possible to eliminate things that will inflame the child's tummy and inflame the child's brain. So as much as we can, we are getting rid of the chemicals. So if you use fruits to infuse the water, they start getting used to it over time. And then we're also increasing non-dairy milk, right? So that's decreasing their constipation, which should improve their sleep, which should improve the way they behave. So you see, every small action you take will trigger a cascade of other things. And so that's dairy, right? And then for food, okay, my child will only eat, I often hear this, chicken nuggets, french fries, pizza. Okay, so what can we do? If your child, for example, if your child will eat spaghetti and red sauce, can we blend in some green vegetables, take off the sauce of the heat, and then add the green vegetables? That way your child is still getting greens, even though they don't see it, because the red will mask the color of the green, right? So
Yes.
that's a simple fix. And okay, say my child chicken nuggets, can we swap out and get gluten-free chicken nuggets, because the breading on the chicken nuggets has gluten in it, right? So we're just making a swap there. They can still eat the chicken nuggets, because I found that as we clear out their tummies, their taste buds open up and they are more open to trying new foods. But we have to get there first. So it's just making small adjustments and progressing along that route. So I hope that helps.
But girl, Doc, yes, that helps. That's a lot. I took tips from that too. Awesome, 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 awesome. Thank you so much for sharing these um tips. And essentially also you highlighted it first when you first said it. You said take care of the brain, because that's where, so the things you do, the whole idea is to take care of the brain so the brain can then better serve the child. Right.
Right.
So avoid limiting chemicalized foods, more natural foods, and gluten you mentioned, and the dairy. Now, of course, these are medical suggestions. We do recommend that you have a conversation with your own doctor to come up with a plan that best serves your child. But this is very powerful. We'll soon be wrapping up, but I do have a few other questions I want to tease out from you. Are there technologies? Are there apps that can help in caring for children, maybe not caring, but educating or helping with their development that you suggest? What would you say to that, Doc?
Okay, good question. There's tons of apps. But the one I don't really recommend apps, but I have found that there is, I don't recall the name, but if your child does go to ABA therapy or goes to see a therapist, there's an app that therapists use.
Okay.
They provide an iPad that helps with speech, right? And
Okay.
it helps, so the kid is able to start pronouncing words after the child. Sorry, after they hear what the app says, and then they try to repeat that. I'm not. I tend not to try to put kids on the screen again, because
Right.
that also is like extremely stimulating to their brains, right? And besides, I haven't really found anything that really helps yet. The only
Okay.
thing I usually recommend is the one that does the speech, like just to help them start saying words back and repeating words and learning words that way. So sorry to on that question, but
That's a good no, but that's a good point.
I find
Sometimes you
that
think you're helping the child, but you
right.
over too much of that could be a problem.
I find
Um,
that it's better for parents to do the um to communicate with your child, right? I know maybe your child's attention span is low, but it does help. It makes a difference more than when you sit down and you're actually talking to your child. So put your phone down and actually talk to your child, even if you're not getting the response, or attempt to read to them, or if they are quiet, read to them. If they're make it like a bedtime routine, reading to them
mm,
and all of that. That really helps more than we think.
Hmm.
because it provides soothing for the child, and so they know they are loved. And the brain, like my first story, the brain does wonders when it knows it's loved. It's
That is
we're not
so
stuck with
cool.
the brains we have, right? Our brains can heal. Our brains can heal. So parents, yes, interact with your children.
I got to write that down. The brain would do wonders when it knows it is loved. My gosh. I'm sorry.
No.
I write that down. That is powerful. And so I want us to end like with words of encouragement. So I have a parent here who is looking like, oh my gosh, I know. And the guilt, the mom guilt, the dad guilt, the oh guilt, oh yes, my child needs more love. Is a lot of work to take care of my child that has this special gifting. And sometimes it puts more pressure on them. Doc, what are words of encouragement you have for that parent who wants to do more, feels a little overwhelmed, and the timepiece is a little hard.
Right.
A little hard.
Yes. Definitely understand that. I mean, I have three children, and so yes, I can attest to the timepiece being difficult sometimes. But it's important, parents, to know that it's not your fault. Where you're not a bad parent, right? Because your child has this. You're the best parent for your child, and to take care of yourself, because I have found, I was just telling Dr. Tolu before I got on that this week was one of those weeks, right?
Mm.
But I found that I wasn't really taking care of myself, and I had to go back and like, what is it? What can I do? What are the simple things I can do to fill my own cup so I can actually take care of my three children? And that's what I would encourage you to do. It doesn't have to be anything big. Just find a few things that make you feel good, that make you feel fulfilled, that fill you up, so you can serve and be and interact with your children from the best place. And you should not feel guilty about that at all. And ask for help. There is help. um Ask for help. We often feel like, okay, my child has this and I'm going to isolate and I'm the only one going through something like this. No, no, parents, mom, dad, you are not the only one going through this. There's lots of parents going through
Mm.
the same journey, right? That can be very difficult. And I completely acknowledge that. But it's so important to find a place where you can get support, where you can ask for, there's daycares. Get your child into a child care situation early, like a Head Start, where they do therapy in Head Starts, right? Instead of, and maybe that gives you a few hours at home. um, Daycare centers that can give you a few hours of respite, so that you can take care of yourself, so you can take better care of your children as well. So
Thank you so much. Thank you so much for those words of wisdom. Sorry, second to the last question. Are there support groups? Like, do you typically recommend resources or support networks for parents and caregivers of children with autism?
yes, there are several large national groups like Autism Speaks, and they have chapters in every state, and they usually will have support groups. But I created one myself because I found that in my area I didn't really have one. So mine is called Glow Brain Health Circles. I called it a circle because embodies my mission, which is to provide a compassionate place where parents can come and get community, get support, get clarity on what to do with their children. And it's not just your regular, uh, I see it as a virtual medical home for parents of children with autism and ADHD, because it's not just me in there. I do live classes every week. So me as the integrative pediatrician, I have somebody teaching about executive function skills, meaning how can we help our children be more organized and help basically the frontal part of their brain function better. I have nutritionists in there, therapists. So essentially, I'm trying to provide wraparound support for parents. Come in there, learn how to what this whole eating healthy means, because there'll be a nutritionist teaching you how to do it and how to shop and recipes to try for your kids. And just yeah. It's
I love it. I
yeah.
love it. And I put the link at the bottom for those of you on YouTube, Glow Health Circle, those of you on Facebook as well. Um, I don't know why Facebook is again. It's not letting me stream this. Okay, let's see. For those of you YouTube, let me put the one on for there we go for Facebook as well, so people can watch that. But Doc, this has been rich. We're gonna have you back. We're already out of time, but we're gonna have you back in the upcoming months in the new year to come have do a second talk. But this has been very powerful for those who are watching. Who are like, "Where's this Doc? I need her to come talk to my group of friends. I need her to come talk at a conference where this is the main issue." Doc, where can people find you?
So my let's see, website is glowpediatrics.com. There's place there you can leave me a message. My email address, I think Doc, you have it, Dr. Eko at glowpediatrics.com. I will respond. Where else? I'm on LinkedIn, I'm on Facebook at Glow
Right.
Pediatrics, I'm on Instagram at Glow Pediatrics. So yeah.
She's all over the World Wide Web. www. She's on LinkedIn too. She's on Instagram. She's on the Facebook. And all those have been put in the comment. Doc, I really appreciate you for coming. Thank you for sharing your Saturday morning with us.
Yeah, my pleasure. It's an honor to talk with you and your audience. Thank you.
Awesome, awesome. Thank you to all of you who watched live. I'm seeing you, Miss Adit Bimpe, Mr. Jimmy, Una. Thank you all for watching. Really appreciate you. Please, as always, sharing is caring. Forward this to those who could find this useful and stay empowered, taking care of your children with autism and beyond. All right. And on that note, if you or anyone you know is looking for an awesome, a thorough and caring family physician who have conversations like this to help you live long and well, I am she. All right, sis. Thank you so much, everyone. Have a good one.
Thank you. Bye, everyone.
This was